DW Africa Link.
Sharing the health data of individuals is very critical and it shouldn't be allowed because health data actually is a personal document, and when it comes to data privacy or data protection, health data is one of the critical personal information.
Ghana's decision to walk away from a multi-million-dollar US health deal is getting a lot of attention across Africa. Many are praising the move as a stand for sovereignty and data protection. Sources within the Ghanaian government told DW the agreement would have required the country to give up key control over its health system, something it was not willing to accept. So what exactly was Ghana being asked to sign? What kind of health data was at stake and what happens next? That's what's coming up. This is Africa Link, the podcast that connects you to the stories that matter across Africa. I am Adwoa Tenkoramaa Domena, your host for today.
Africa Link, every weekday here on DW.
Ghana has rejected a health deal under Donald Trump's America First bilateral health agreement. The deal was reportedly worth around $109 million US dollars, equivalent to 93 million euros. Key concerns raised by the country include requirements of sharing control over its healthcare decisions, data, and resources with US authorities. Zambia and Zimbabwe have also rejected similar deals, citing concerns over sovereignty. Now, all this comes as the United States scales back major health support through USAID. So what does this decision mean for healthcare access and delivery, particularly in Ghana? To help us unpack that, I have been joined by my colleague, DW correspondent in Accra, Ghana, Eric Mawuena Egbeta, who broke that story. I also have the Executive Director for the Africa Center for Security and Counterterrorism, Emmanuel Kotin. Welcome to both of you. Mawuena, walk us through the considerations it took for the Ghanaian authorities to decide that we are walking away from this deal.
We know that negotiations, particularly on this new aid pact from the US, had come before the table, had been debated quite extensively. From the Foreign Affairs Ministry level, it went to Cabinet, and there was the conversation as well in Cabinet. The areas which stuck out, which were matters of concern, primarily hovered around data protection matters. And so as part of this $109 million US dollars, which was to span for a period of between 5 and 25 years, would have required a sharing of health data of members of the general public here in Ghana. And it also required a certain waiving of parliamentary ratification of the agreement. And for Ghanaian officials, they were like, this doesn't quite come out well in terms of handing out public health data to officials in Washington. It didn't quite make sense. In fact, having conversations with the source who provided the details, our government was willing to bend over if certain aspects of the agreement could be looked at again. I'm speaking in terms of quoting directly because I caught wind of excerpts of the communication which went to the US officials, where the foreign ministry officials, who were the ones who would have communicated this, made it clear that, unfortunately, I quote, we cannot proceed with this because it does not go in our favor. If it will flout data protection acts and then public health act as well. From what I understand, Washington was not too pleased with the fact that the Ghanaian government had decided not to proceed, but that is where we are at the moment.
Right. Thank you for that. Emmanuel, what immediately stood out when you heard that Ghana has decided to walk away from such a tempting amount of money?
Well, thank you for having me. In fact, two things stood out very significantly. One is financial, Can you believe that Ghana walked away from a $109 million in health funding over 5 years at a very critical time when USAID dismantling has already left serious gaps in our country's health architecture? To me, this is not just a symbolic gesture, it carries some form of real cost. But the deeper significance is institutional. And that is what your correspondent alluded to. The Ghana Data Protection Commission did not merely express discomfort. And if you listen to the executive director, he stated on record that the data access demanded went far beyond what the purpose of the agreement required. That is a regulatory finding. It means that Ghana's refusal was not political posturing, like many people would look at. It was a sovereign institution applying its own laws. And that is a qualitatively different kind of refusal, and it deserves to be understood as such.
Interesting. We have learned that Ghana would have been required to share health records with the US for a period of about 25 years, even though the aid program itself, the deal itself, was designed to last over 5 years. How problematic is it?
That's a very interesting question, but we need to contextualize it. If you look at the data dimension, it was technically specific, you understand? The US sought access to sensitive health data on Ghanaian citizens without, in our own assessment, adequate legal safeguards. That is data governance matter governed by domestic law. You know that as a sovereign country, whoever is at the realm of affairs as the president of this country swore an oath to uphold the constitution of this country. So the sovereignty dimension runs underneath all of what we are talking about. When Ghana declined, what did the US negotiation team do? It is reported that they became so hostile and escalated some sort of pressure on our team. That moment where a donor country intensified coercion after a recipient country exercises its legal rights, it raises certain red flags. And it can only be a sovereign question made visible. You see, aid relationships have always carried power asymmetrics. What is new in that recipient government and what we are talking about now is this asymmetric publicly known. And they have that institutional language and legal infrastructure to do so. So I think that the world has come to a stage where we can no longer do things the way we used to do. I think partnership is the way to go. And the Trump administration, they are trying to change the foreign policy dynamics of not only the United States of America, but the world.
We'll go into the foreign policy aspect in a bit, but help me understand, if I'm a Ghanaian and this deal was accepted, what was I going to be exposed to? Why was the government afraid of giving this health data to the US government?
You see, from the intelligence some of us have gathered and the information that was being sorted, it was highly unusual in this form. You see that traditional aid conditionalities have centered on policy reforms, procurement transparency and financial reporting, and sometimes government benchmarks. They demanded the access to individual health data on sovereign citizens is a different category of condition entirely. And Ghanaian citizens will not be happy and they wouldn't even know the kind of safeguards their data will be used in a foreign land for. What makes it even more troubling is the pattern emerging across the continent. In Nigeria, the US agreement reportedly directed funding primarily towards Christian faith-based health providers. And that is raising issues of equity and constitutional questions. So if you look at in our case, and we are in the same league as Zimbabwe and Kenya, it is the data terms that we have refused because we cannot understand what a Ghanaian sitting in Accra or in my village in Sawoba, where I come from, very deprived area of the northern region, our data will be doing in the United States of America. And I think that this is where the government is even afraid to come out publicly to explain why they refused them pulling the sovereignty card. And you know, Ghana was the first country in Africa to gain independence through Dr. Kwame Nkrumah. And that Pan-African card still resonates with a lot of people across the continent, especially in Ghana. And that is why the Ghanaian government, even though are losing a lot of money at the time we need money for our health infrastructure, they are, gaining some form of faith in the Ghanaian people. And if you look at our democratic credentials, we stand tall in terms of political currency in Africa. And I don't think Washington will want to coerce us and have trouble with Ghana. Because if that happens and that relationship is broken, it means that Washington will have problem confronting violent extremist group within the Sahel, given the important role Ghana is helping the United States of America in terms of its security architecture, not only in the Sahel, but in West Africa.
Thank you. Zambia is actually still on the negotiation table trying to ask the U.S. government to take out certain aspects that they feel that doesn't work for them. But let me go to Mawuena. Mawuena, in February, when Zimbabwe rejected their deal, I saw a post on X from the U.S. Embassy in Harare, which said, and I quote, "The difficult and regrettable task of winding down our health assistance in Zimbabwe is beginning." So essentially, there seems to be implications attached to a country deciding to pull out of the US deal. What does this mean for Ghana and the country's health system?
Well, there's a bit of uncertainty. And I think, like you mentioned, based on earlier conversations, that has remained for quite some time, this level of uncertainty since the cancellation of USAID support and all of that. On the part of the government, and particularly the president, there's been attempts to seek alternate source of funding. And so somewhere last month, there was a $20 million, if my mind serves me correctly, agreement that was reached with Japan, which was supposed to provide some funding support for health care in the country. On a personal level, the current administration, based on manifesto promises and all of that, has introduced a number of projects. So there's the Mahama Cares for one, which is seeking to source funding support from private individuals and what have you to provide care for non-communicable diseases, which is fast becoming a thing in the country as well. Then the president has been leading the charge with Accra Reset on the health front. Last month, he was in France, where he co-chaired with another president, and conversations surrounding making access to research and findings in relation to health and other related matters easily accessible to all, so that we can all combat diseases and help better the lot of our people. Those are the frontages from which the present administration is seeking to tackle this head on. Obviously, there's been the gaps which have come about. Last year, when the USAID freeze came about, there was a directive for the finance ministry to find resources to clog the gap this year, we've seen the budget statements come through as well. The health budget is not the biggest in the country, but it continues to remain one of the most challenged areas. And so they continue to navigate it, but I mean, you and I both can tell that once funding gaps come through where there's a lot of grant on matters of health, then there's a potential that there could be a bit of challenge in terms of delivery across the board. None has popped up just as yet outside of recruitment of nurses to fill up vacancies in hospitals across the length and breadth of the jurisdiction. Outside of that, we haven't heard, or there hasn't been any reports just as yet as to critical medication or vaccines that are supposed to go elsewhere which haven't, or specific programs which are supposed to receive funding which haven't just as yet. But we just finished the first quarter, and the second quarter, no, I think we're in the second month of the second quarter. And so we are waiting to see when a refusal of $109 million begins to bite hard.
Very well. I have one last question for the both of you. Emmanuel, I will give you yours now. The amount we're talking about is huge. $109 million, could roughly translate to about 1.3 billion Ghana cedis. My math is correct. That money could have done a lot for Ghana's health system. We are currently, in an era where we are talking about power outages. We know what impacts that has on hospitals and healthcare delivery. We could begin to talk about, procuring standby electricity sources for these hospitals and a lot of other conversations. For you, do you think Ghana should continue pushing for this agreement, in a way that the country can still get the money and still be able to protect its citizens' data? Is that even a possibility on the table at the moment?
Thank you once again. If you listen to government posture carefully, they are not trumpeting what happened because they still believe there could be a window of opportunity to revise the deal. Because if you look at our public health system, it has really come under very compounding pressure. If you look at the National Health Insurance Scheme, it has faced chronic underfunding for a long period of time. And you remember the COVID-19 pandemic as well. It really exposed our structural deficiencies in health infrastructure, our supply chains and workforce capacity that were already present before the crisis. So to me, I think there should be a way out of this. The saddest aspect is that USAID had been one of Ghana's most consistent external health partners. Its program covered our HIV treatment and prevention, our malaria case management and tuberculosis as well. And if you look at maternal and child health, they were the largest beneficiaries from USAID. And troubling is that all these things, the effects may not be felt now, especially in the cities, but in the northern part of Ghana and many underserved areas where I come from. If you look at the withdrawal of that architecture, it did not merely reduce the budget line. And that's what we must get very clear. It disrupted an ongoing program. It broke supply chains for medicines and diagnostics and left many local NGOs and health facilities that had been operating under USAID grant suddenly without funding. So into this very gap, I think I will propose a bilateral deal that will sort of bridge whatever misunderstanding that is between the United States of America and Ghana, because we really need the $109 million over this 5-year period. It means that it translates into $21.8 million annually. And this will help us in our HIV, malaria, tuberculosis, and other infectious diseases. We cannot manage this burden on our own without any fully resourced domestic health budget. And that is the problem with the government of Ghana. We don't have a dedicated resource domestic budget to fight these infectious diseases. So I think that they should leave the diplomatic channel open and see how they can iron out the fine edges, because Ghana and the United States of America have been very good partners since independence.
Very well. Thank you so much. Mawuena, you have the last words. In terms of the last point that Emmanuel made, diplomacy, is there any fear at all that this particular botch deal could mar the relationship between Ghana and the US?
It's been there. I think Emmanuel mentioned what was pressure brought to bear at some points during the negotiations, one of which our source as well confirmed to us. In fact, it was shy of only mentioning that this has caused a bit of a rift, but from the conversations, it suggested that Washington was not entirely pleased with the fact that we've had to, what comes off as a questioning of the authority somewhat to a larger extent, because one Zimbabwe did it, one Zambia did it, then it looks like U.S. power is being questioned the more and more, and for them, it comes off as that. But if there's anything, we know that Ghana and the U.S. have had very great relations. When a number of countries were put on a blacklist in terms of travels, after a short while, Ghana was taken off that list based on negotiations and conversations which were had. And so there's that expectation that it could just work around our favor again in terms of Ghana on that score. But for now, yes, there's that concern that this could slightly mar what has been excellent relations enjoyed between both states for some time. But the expectation nonetheless will be that this could be promptly rectified and dealt with as well.
Very well. Thank you so much for that. You just heard Eric Mawuena Egbeta, DW correspondent in Accra, Ghana. Earlier, you heard the executive director for the Africa Center for Security and Counterterrorism, Emmanuel Kotin. Thank you, both of you.
Thank you for having me.
Thank you for having me.
Now, while this decision for Ghana is seen as a principled stand, reactions have been mixed, with some viewing it as a financial gamble, especially for the country's health sector.
Sharing the health data of individuals is very critical and it shouldn't be allowed, because health data actually is a personal document, and when it comes to data privacy or data protection, health data is one of the critical personal information that individuals have. So I don't think it's a good idea to share that health data.
For me, I don't agree with that, because sharing those information with other countries might go against us. I mean, security and other reasons put in place is not a good idea. It might go against us as a country. So I don't agree with that personally.
Because if we are going to get some aid out of it, or they should come in and we should share our this thing. So far as we will have aid in support of it, or we should share our health status.
No, I don't agree. I don't agree. As an African, I can't agree with that. Because how my health system will be in outside way at the Africa, I don't know what they do with them. And that's why I don't agree.
Despite growing resistance, several African countries have gone ahead and signed similar agreements. According to the U.S. State Department, at least 32 deals worth around $20.6 billion have been concluded under the America First Global Health Strategy, including with Nigeria, Rwanda, Uganda, Lesotho, and Eswatini. So, what's the situation in your country? Has the deal been accepted? Has it been rejected? Or is it still under discussion? Share your thoughts with us on Facebook and on TikTok at DW Africa. Listen to us on Spotify or wherever you get your podcast. And don't forget to subscribe to our DW Africa YouTube channel. This show was co-produced and edited by Eddie Micah Jr. I am Adwoa Tenkoramaa Domena. Bye for now.
DW. Made for minds.